Hello, I'm Jennifer Whitney. I'm a licensed marriage and family therapist with a practice that focuses on addiction. I have seen firsthand what the use of opioids can do to individuals and families. The California Department of Public Health works to protect the public's health in the Golden State and help shape positive health outcomes for individuals, families, and communities. As part of this mission, the department is implementing a comprehensive approach to address opioid misuse and prevent overdoses. The purpose of this video is to support these efforts by providing information on opioid use, the signs of an overdose, and how to use the life-saving drug Naloxone. In this video, you'll learn how to prevent an overdose, how to recognize an opioid overdose, including how to check responsiveness, how to store and administer Naloxone, how to alert emergency medical services, how to administer rescue breathing, how to place the subject in the recovery position, and how to provide post-overdose care. Before we talk about how to recognize and respond to an overdose, let's take a quick look at what opioids are and what puts people at risk of an overdose. Opioids are among the world's oldest known drugs, typically used for the relief of pain. Some of the most common forms today include oxycodone, hydrocodone, methadone, heroin, and fentanyl. Naloxone is an effective and safe medication. Naloxone acts as an opioid antagonist or blocker, which can reverse an opioid overdose. Naloxone is not addictive and cannot cause harm to anyone, including those not suffering from an opioid overdose. Naloxone is easy to use. This training will discuss the various forms of Naloxone and prepare you to use them. Always be sure to carefully read the instructions that come with each Naloxone product, including how to properly store Naloxone, which is usually at room temperature. But before we talk about how to use Naloxone, we need to talk about the signs of an overdose and how to tell the difference between someone who is high or sedated and someone who may be suffering an overdose. Many overdoses are due to a combination of an opioid and other drugs, such as alcohol, benzodiazepines, and sleeping aids. In addition to mixing drugs, other factors can contribute to the risk of overdose. These include variation in strength and purity of the drug used, switching the mode of administration, for example, a change from snorting to injecting, lower tolerance after a period of abstinence, low tolerance from lack of prior use, using the drug alone, and physical health. In your interactions with those who use opioids, you may have opportunities to suggest strategies which can help them reduce their risk of an overdose. These include knowing their tolerance, knowing their supply, controlling their own high, being aware of the risks of mixing drugs, not using alone or having a trusted friend to check on them, having a plan, talking with others, and using drug testing resources, such as fentanyl test strips, if possible. Not all strategies will be appealing to people, but engaging them in an honest dialogue about their use can be very beneficial. The symptoms of someone who is high or sedated but not suffering an overdose include relaxed muscles, slow or slurred speech, looking sleepy or nodding out, will respond to stimulation such as yelling, sternum rub, or pinching. Now, on the other hand, someone who's suffering an overdose will usually exhibit some or all of the following symptoms: deep snoring, gurgling or wheezing, blue or grayish skin tinge, usually the lips or fingertips darken first, pale, clammy skin. The person will not respond to stimulation, and the breathing is very slow and irregular or has stopped, and the pulse is faint. These symptoms occur because opioids cause respiratory depression or reduced respiratory function, resulting in increased levels of carbon dioxide and decreased levels of oxygen in the body. When breathing stops, the lack of oxygen can cause brain damage, and if the oxygen supply is not restored, the heart will stop, resulting in death. Here is the 6-point checklist you should follow in the event of an overdose. First, check responsiveness. If unresponsive, administer Naloxone, then call 911. While waiting for emergency medical services to respond, administer rescue breathing. If you are trained in cardiopulmonary resuscitation or CPR, this technique can also be used. Place the person in the recovery position, and finally, administer aftercare. If you suspect an overdose, check responsiveness. You can do this in several ways: by rubbing their sternum in the upper chest area, by yelling at them, or pinching them. If there's no response, you should administer naloxone immediately. Make sure that you've studied the instructions in your naloxone rescue kit. There are 4 common naloxone products: nasal spray, like the one we're using today, Narcan, which needs no assembly; nasal spray from a syringe-type applicator, which requires assembly; an auto-injector, which can deliver a dose into the outer thigh, even through clothing; and injectable naloxone from a vial via a syringe. For the Narcan nasal spray that we're using, hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your other hand. Place the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to place the full dose into their nose. If after 2 minutes the person is still unresponsive, you can give a second dose in the alternate nostril using a new device. Administering a second dose before 2 minutes are up is a common mistake, as people often panic. While this won't cause any serious side effects, it may exacerbate the withdrawal symptoms that come with the naloxone rescue. We'll talk more about this when we get to aftercare. If possible, have someone call 911 as soon as you've determined the person is unresponsive. If no one is available to do this, call 911 immediately after you've administered naloxone. Whoever calls 911 should state that the person is not breathing, is unresponsive, and that you suspect a possible overdose. The caller and the person administering naloxone are protected from any liabilities by California Good Samaritan laws. Once you've administered naloxone and called 911, begin rescue breathing. If you're trained in CPR and feel comfortable doing it, you can also include this technique. Rescue breathing is one of the most important steps in preventing an overdose death. Place the person on their back. Place your hand under their neck and tilt their chin up. Make sure that the person's airway is clear so air can get into their lungs by checking to see if there's anything in their mouth blocking their airway, such as gum, pills, or food. If so, remove it. Use a mouth shield or breathing mask when performing rescue breathing, if you have one, to reduce your exposure to other possible health risks. Placing one hand on the forehead, pinch the nose to prevent air from escaping out of the nose. Take a breath, cover the mouth with your own, and breathe out. You'll see the chest rise as it fills with air. Repeat this at 5-second intervals. If possible, stay on the phone with EMS dispatch until the emergency response crew arrives at the scene. Once you've determined that the person has emerged from the overdose and is breathing regularly, place them in the recovery position to prevent aspiration or choking. Kneel on the floor at the person's side. Place the arm that is nearest you at right angles to the body, bent at the elbow so that the hand is pointing upward. Pick up their other hand and place the back of their hand on their opposite cheek. Keep their hand there to guide and support their head as you roll them. Now, use your other hand to reach across and lift the person's knee that is furthest from you. Pull it up so their knee is bent and their foot is flat on the floor. Now, pull their knee toward you so they roll over onto their side, facing you. Move the bent leg forward and away from their body so it's resting on the floor. Finally, raise their chin, tilting their head back to open the airway. People wake up from an overdose differently, and while violent reactions are rare and are usually associated with being given too much naloxone or waking up in disorienting environments such as an ambulance or emergency room or with police present, it's important to keep them calm and explain what has happened. Often they may not even realize that they had overdosed. Of course, you should make sure they don't try to ingest more of any drug. The effects of naloxone vary, lasting between 20 to 90 minutes. It's very important to call 911 and to stay with the person in case another dose of naloxone is necessary. Long-acting opioids present the greatest risk of resedation or a return of the overdose. So it's important to get further assistance if the person has taken a long-acting opioid, such as methadone, and to watch them for a while after they wake up. The most common result of a naloxone rescue is the uncomfortable feelings of withdrawal that accompany the blocking of opioids in the brain. Completion of this naloxone rescue training means that you are now equipped with the information you need to administer naloxone in the event of an overdose. Thank you for your time and your commitment to ensuring you are properly trained to save a life from an opioid overdose. For the California Department of Public Health, I'm Jennifer Whitney.